Welcome, Hema Srinivasan. Thank you for joining this series of videos on market shaping by MedAccess. It's really good to have you today. Uh,
Thanks. So nice to see you, Mike.
we're just going to start with a kind of general introduction to the series is on market shaping. So you started off life after university working in investment banking, and then went to work for the Clinton Health Access Initiative after that. Can you tell us a bit about how you became involved in market shaping and why it matters to you?
Sure. So yeah, as you noted, Michael, my entry into market shaping was fairly early in my career. So after my undergraduate studies, I went into investment banking, covering the biotech sector as an equity research analyst. And I want to just take a minute to explain what an equity research analyst does, because I think it sometimes can be sort of shrouded in mystery to the wider world. So the fundamental job is really to figure out if a stock is overvalued or undervalued. So we spend quite a lot of time as research analysts speaking to the largest shareholders of the companies we cover. So major hedge funds, mutual funds, and what we're really trying to figure out is what are their expectations of the company, and essentially what is priced into the stock. So the current levels that it's trading at, what are the kind of expectations embedded within those. And on the flip side, we're spending a lot of time talking to the senior management teams of those companies to understand, what is their vision, what is their execution ability. We're doing a lot of independent research too, and trying to sort of piece together what is the strength of the pipeline that they have in their portfolio of products. And we kind of put all of these pieces together and try to figure out over the next few months, is the stock going to go up or going to go down? And I go through all of this just because I think there are actually some interesting parallels in the work of an equity research analyst and the work of a market shaper. And so this kind of early experience for me, I think, was sort of foundational to the career that I've built in market shaping. I think, to be honest, there's just this need to fundamentally understand the business of running a biopharma company, whether you're going to do global health market shaping or you're going to do equity research. You have to really understand what are the incentives, what are the pressures, what are the risks that a senior leader running one of these companies is sort of facing every day. And of course, if you work in equity research, your goal is to sort of improve the financial performance of the company. So you're kind of doing all this analysis, recommending what the company needs to do in order for the stock to go up. And then your kind of influence is via these major shareholders. On the flip side, in the global health world, our goal is to drive greater access to critical health products in underserved communities. And our influence is, kind of political, um, potentially financial if there's a lot of donor funding behind a particular priority. So, they're kind of similar. There's some parallels, I would say, to the work an equity research analyst does and the work that we do in market shaping. So, um, anyways, fast forward to Hema Srinivasan coming out of undergrad, going into equity research. I always knew that I wanted to work in public health, but I felt when I came out of college that I didn't understand anything about healthcare as a business. I didn't know what kinds of companies existed, how they worked with each other, what incentives they had. So, in speaking to a number of different classmates and colleagues, I decided going to equity research would be a great way to gain some perspective on just the healthcare industry. Um, but I always had in the back of my mind, I need to make this transition to public health. My assumption was I'd have to build a completely new skill set. So I'd kind of come into public health with some perspective, but have to essentially kind of start over my career. But I met this woman who was a friend of a colleague. She had worked in private equity and then gone to the Clinton Health Access Initiative, or CHI. And she really inspired me because she said, those corporate finance skills you built, we can actually use them to improve access to health products. So I was just so inspired by that discussion. I immediately applied for a role running CHI's HIV analytics. And so I joined. The first few months, I was building market sizing analyses for different HIV treatments, writing our HIV market report, which is still published to this day, going to India, talking to generic manufacturers, trying to just figure out how do we sort of improve access to HIV medicines. And within a couple of months, I had met Ira Magaziner, the founding CEO of CHI, and a number of colleagues who were working actively to negotiate access agreements with big pharmaceutical companies. And in talking about my experience in investment banking, we realized actually this is the perfect fit. We're trying to figure out how to sell these big access initiatives to these CEOs. So someone who understands the commercial pressures they're facing might really be able to help us craft the right pitch, craft the right business case to actually get the deal done. So I was thrust into the field of market shaping, honestly, before we really called it market shaping or had established much of a discipline around it, and spent the next several years working with IRA, helping to negotiate volume guarantees and buy downs and access agreements, product donations, and that kind of propelled me through my next few career moves as well. So into Gilead Sciences, so running the business in South Asia for a pharma company, and then to MedAccess, where obviously we were working on market shaping finance agreements, and to the work that I'm doing now, trying to sort of envision what the future of market shaping can look like in a sort of regionalized, localized world, and with the power of AI behind us.
So you in the commercial world, working for investment banks, doing this analysis of which companies are likely to thrive and possibly be profitable in the future. So you gauge the stock price. But in the back of your mind, a thought, well, I want to do something about public health at some point.
Yeah.
And then you're given the proposition, well, you can use these same skills to apply to global health. Did you think at that point, gosh, I need to go out and get a master's in public health so I understand epidemiology? Is that?
I did. Actually, there's an old notebook that I came across when I was cleaning the house a few weeks ago where I had listed, this is when I worked in investment banking, so maybe circa 2010 or 2009, and I had listed all the Masters of Public Health programs in the US and how much they cost, and did I need to take the GRE, GMAT to get into them. So I really thought that would be needed, and I also thought, these skills of sort of building income statements and balance sheets and cash flow statements, there was no way those could be relevant to kind of improving access to public health. And I also thought my career would focus on public health in the US. I went to undergrad in the US and had done a lot of work in harm reduction and sort of thought that was the direction I was going to go in. So there were a lot of things that sort of surprised me about the transition to Chai. And I probably had imposter syndrome the first several years I worked at Chai. Just always sort of would pinch myself and say, well, gosh, what do I know about running a health system in Kenya? What business do I have doing this work with no real qualifications, having never lived in many of these countries? So it was kind of a struggle the first few years to convince myself that really I did have some value I could add. So really had to see a few of these market shaping interventions play out and see the impact that we had before I could convince myself I really belonged.
You mentioned while you were at Chai, you had a sense of imposter syndrome. Not sure, were you the right person to be tackling these huge global questions? I expect other people may have that coming into market shaping as well as they first enter. And I wonder if you have any advice for people who are coming into this field and how to approach it.
Yeah, any skill set you bring from your prior career could potentially be valuable in designing market shaping interventions. You could be someone who's a really effective project manager. That's going to be invaluable as we're sort of going through months long process of analyzing a market, bringing different stakeholders together, negotiating an agreement, and then communicating that to the world, and then finally implementing it once you've actually signed and communicated the deal. You could be someone who is a great salesperson, and you could be really helpful in producing a pitch deck to convince a purchaser or supplier to be a part of a market shaping intervention. You could be someone who's a great analyst, and you're going to develop the best demand forecast we've ever seen. Helps us to sort of size the risk of a potential agreement. There are lots of different skill sets you can bring to the table. These are massive kind of multi-stakeholder, multi-sectoral interventions. They involve not just the financial instrument, but kind of creating a wider ecosystem of actors that are aligned to actually improve access to a health product. So I would say almost everyone has something they could contribute. So come to the table confident with that. And the second piece of advice I would give is find your motivation. So the most effective market shapers are the people who are passionate and vulnerable and have a story and have a reason why they're doing it. So, for me personally, the motivation comes from my family's experience of TB over centuries. We come from Chennai, from southern India. We've had countless relatives who we've lost to TB. And I, reflect on this story often. I don't talk about it often, but I reflect on it often. So my great grandfather on my mother's side died of tuberculosis when he was just 20 years old. Like, he was 3 years into his marriage to my great grandmother, and he had just had a baby 2 years prior. And my great grandmother was sort of the matriarch of the family. Everyone has a woman like this in their family lore who just kind of embodied love and resilience and wisdom. And to me, that was my great grandmother. And here she was, 16 years old, widowed, with a 2-year-old baby. She had been pulled out of school in the first grade. So her fate was always going to be tied to her eventual husband's. And I just think about what a destabilizing moment that was to lose your husband to TB. It meant that, when my grandmother eventually got married, my great grandmother had to move in, become a full-time nanny, cook, cleaner, tutor, plumber, all of the things in my mother's household. And fast forward, 23 years to after she lost her husband, and my mother was 2 years old at the time and contracted TB. And imagine again my great grandmother sitting here, and this vulnerable child that she's taking care of has the same disease that her husband died of. But in those 2 decades, isoniazid had been invented and launched in India. And some of my mother's earliest memories are of this blue pill bottle that has isoniazid printed on the side, and this bladder that she used to blow into to test her respiratory function. And in fact, the first picture we have of my mom, she's 3 years old. She's sitting on a stool. She's sobbing because, as she recounts it, the camera reminded her of the X-ray machine that she became so well acquainted with in her early life. So, yeah, my mom, we can laugh about it now. She was cured of TB. She went on to lead a long and fulfilling life. So it never has been lost on me that my mother and I are only here today because of the discovery of isoniazid, this really simple medicine that costs just pennies to make. And so every time we talk about, academically, a 5 to 10 year delay in a product that's developed in the US, making it to India or to Africa, I think of all the lives and potential lives that could be lost in just those 5 to 10 years. So find that motivation. Everyone has it. We're all mortal beings. We all need healthcare. We all deal with health issues. We lose loved ones. Find what motivates you. Keep that in the back of your mind. Even if you don't talk about it every day, people will sense it. They will feel your urgency. And when they feel your urgency and your passion, you will be successful in market shaping.
That's great. For me, there's a connected story, which is the one that Atul Gawande mentioned in a recent interview. Atul said, 150 years ago, none of these products exist.
Yeah.
And they now exist. And our job as a generation, our generational challenge, is to make sure that these things that have now been invented get into every village in the world.
Yeah.
And that means tackling all of the challenges along the way, which I find inspiring as a generational challenge.
Such a short period of time. Like, every time I think about my mother's life, I'm like, God, just 20 years made all the difference, right? Like, between life and death for you. And gosh, like, it just inspires this strong sense of urgency in all of us. I mean, it's easy to get lost in the terminology, market shaping, access, availability, affordability, but like, real people's lives depend on these medicines. I mean, depends on the medicine. Not every medicine is going to save someone's life, but sometimes they do. And gosh, I mean, we have such an opportunity, such an imperative to sort of get products into the hands of people who can benefit from them. It sounds like a very, pablum answer, but there's real meaning behind it.
Yeah. So why don't we go on and tell me about how you got involved in market shaping, exactly what you're working on. Maybe give us an example of
Sure.
what market shaping intervention looks like. What's it trying to achieve, and how does it work?
So I think it would be useful to maybe focus in on the implant access program, which was one of the first really large scale market shaping interventions I had been a part of. And, I'm biased. I was involved in setting this up, but in my mind, this is a landmark, market shaping agreement. There were a lot of things that changed and evolved within the field as a result of this deal. So as context, the family planning community realized the potential that this product, contraceptive implants, could have many, many years prior. And just to kind of paint the picture of what the product is, they're these small, just a couple inches long, hormone-releasing rods, very thin, just a couple millimeters thick. They're inserted into a woman's arm, and they provide contraceptive protection for 3 to 5 years or until they're removed. So you can return to fertility very quickly, as with most hormonal contraceptives, as soon as it's removed. In practice, that makes contraceptive implants just much more effective than other contraceptive methods. So if you can imagine, you're taking contraceptive pills. Every month you have to go to the pharmacy and pick up the pack of pills. Every day you have to remember around the same time of day to take a pill. If you're taking injectable contraceptives, you have to book an appointment, go to the clinic every 2 to 3 months to get your injection. So in many ways, implants are just much more convenient. They don't require regular action by the user, and that's really what drives their efficacy in real-world settings. And so when women were surveyed in Africa, in Asia, around 2010, 2011, and they were presented with all the available contraceptive options and asked, what would you prefer if all of them were available? Anywhere between 15 to 50% of them had said, we want implants. But in practice, in 2011, only 1 to 2% of total contraceptive users were getting implants. So when you kind of look at that disconnect, like 15% plus would want this product, we know it's more effective than most of the other products out there, and only 1% are getting them. We knew we could have tremendous impact. And, evidence on family planning is very clear. So we know, in addition to the impact you have on individuals' life, there's tremendous impacts on society, on economies. So yeah, we knew right off the bat, if we could actually kind of bridge this gap, we would have tremendous public health impact. So why weren't these products getting to more women? When we looked into this and started having conversations with different market actors, we learned that actually the price of implants was incredibly high. And even when you adjusted for the much greater efficacy, so you looked at the kind of cost of implants versus the years of protection they could offer, they were still incredibly expensive. And basically, in a world where you have constrained public health budgets, there was just no way that purchasers, ministries of health, could go out and try to increase access to implants. It would mean at the end of the day, they're providing fewer women with contraceptive protection. And of course, there were other reasons why implants weren't getting to everyone who wanted them. There weren't enough trained health providers who could insert and remove the products from a woman's arm. There were governments who had yet to introduce policies that would actually support wider uptake. There were a number of issues related to supply chains, both globally and in country. But even if you solved all of those, it wouldn't make a difference if the price remained high. They were just sort of prohibitively expensive. So we went and talked to the suppliers. There were 2 manufacturers who were qualified to sell to USAID and UNFPA. They were Merck and Bayer. And USAID and UNFPA, by the way, were the kind of major purchasers for low and middle income countries, still are today when it comes to contraceptives. So we went to Bayer and Merck and we asked them, well, you're aware that there's this huge potential demand for these products and you could have so much impact, and what's going on? Why are the prices so high? And actually they had reduced prices modestly over the last, 5 to 10 years, from about $23 a unit to $17 to $18. And they said, there's just no way for us to bring prices down any further. So first of all, the volumes are relatively low. We can't unlock any further production efficiencies at the current volumes that we're manufacturing at. So there's no potential for us to reduce costs and for that to drive prices down. Secondly, the order volumes were really volatile. So month to month, 1 month you produce a massive number of implants, the next month you produce almost nothing, but you still have to pay the same overheads. So when you're pricing the product, you have to kind of account for that volatility. And then third, the markets were pretty fragmented. So they had just tons of different packaging and labeling requirements across different countries, which again increases the cost of production. So we took that feedback. We went and talked to the big purchasers. We talked to ministries of health. We said, this is what we're hearing. What's possible. We developed demand forecasts. We thought about, whether it was really possible to improve forecast accuracy, whether it was really possible to kind of harmonize those packaging labeling requirements. And we went back to the companies and we said, we think we can do something here. We think we can guarantee that you're going to get much higher sales volumes. We think we can sort of support the purchasers to improve forecast accuracy. And we think that we can do something about harmonizing some of those packaging and labeling requirements. Not all of them. There are many different languages spoken in the 69 low and middle income countries that we were focused on. There are kind of legitimate reasons why you need different packaging and labeling standards country by country, but there's some room for us to harmonize those. And the companies both said, well, yeah, if you could do all of that, we can reduce the prices. So the Gates Foundation, the Clinton Health Access Initiative, a number of other partners, so big family planning donors like the Norwegian government, the Swedish government, Children's Investment Fund Foundation, UK government, USAID, UNFPA, Ministries of Health, all miss, countless partners. But we worked with all of these groups to design an access program for implants that was centered around 2 volume guarantees that lasted 6 years, provided to each of the 2 suppliers. And in exchange for that, we secured a 50% price reduction, and the impact was massive. So we ended up saving more than $500 million for public sector purchasers. We increased the usage of implants from about 2 million units in 2011 to 13 million in 2023. And there was actually a study done that showed the increase in contraceptive usage from 2003 to 2017 was primarily driven by implants, which is really compelling. And on the supply side, there are lots of fears when we do these volume guarantees. I think one of the primary fears is you're going to entrench monopolies or duopolies, but competition actually increased in this market. So we saw a third supplier enter the market in 2017. And the other big fear, I think, is prices are just going to go up when the volume guarantee ends. And in this case, again, prices have remained below the $8.50 we negotiated even 13 years later, despite massive inflation. So the impact has been tremendous. There's also been impacts beyond implants in the wider family planning community and also in the wider global health community, as we've seen sort of support for volume guarantees increase and the impact as a result of that increase over time. So this was, to me, just a landmark agreement for many reasons and just a really inspiring example of what's possible when you kind of bring the right actors together at the right time, the right place, and you have the kind of market shaping tools to back that up.
We have a revolutionary technology. You're talking about something and of course, implants are not for all women, but for women who want them,
Yep.
this is a revolutionary product. It makes life predictable and controllable for 5 years instead of being subject to stockouts and so on. Really powerful technology, only getting to about 1% to 2% of those who want it. You're looking at 69 countries. So this is potentially a revolutionary change you're looking at. And one of the components I'm hearing from you is there a lot of analysis here of what the market's fragmented, there are regulatory barriers, there are challenges with distribution, challenge with volatile orders, identifying all of these problems. You're tackling all of those, but along with it, you used a financial instrument, which is a guarantee of sales, which is potentially, some might say, gosh, this is a really big subsidy for large multinationals because you're guaranteeing they're going to sell something. But when you're thinking about solving that problem, there are multiple ways into thinking about how to shape this market, how to get more product into the 69 countries you're trying to serve. When you're thinking about that, how do you think about the various tools to be used to tackle the problems? And I know you contributed to a really important USAID publication that kind of looked at the full range of tools that can be used. So you could tell us a little bit about that. I mean, why was it you needed the volume guarantee with implants, but what are the other approaches that can be used to help get products into market faster and more effectively at lower prices?
Sure. Yeah. So I think there are many tools described in the different publications and frameworks that the global health community has produced. So I would sort of refer people to those publications if they want to see an exhaustive list. A couple other tools besides volume guarantees that we've used pretty frequently in the past 15 years, and we've sort of published case studies on them. You can sort of read more about them online. We've seen tremendous impact, include one, development incentive grants and 2 procurement guarantees. So the way development incentive grants work is you have a donor that provides some incentive funding. They're not going to cover all of the research and development funding to develop a new product, but some funding that can spur development of critical health products that are not available, or they're not available the quantities needed to meet demand in the developing world or at the prices that are needed. So Unitate has done this many times before. These have been very effective in sort of bringing new technologies, sometimes better designed technologies, but new technologies that can actually meet the demand at the prices that are required in the developing world. This third tool that I want to describe, so first was volume guarantees, second was development incentive grants, the third is procurement guarantees. These are kind of tools used by purchasers. So a financier gives a purchaser a pot of money. They're able to use that to sort of secure products at risk, potentially negotiate better prices. So they can either offer mini volume guarantees to a supplier, they can provide advance payments, or they can just take delivery of product at risk, all of which helps them to get health products to where they need to be on time without having to wait for cash flows to percolate through the system.
So one you haven't mentioned is the advanced market commitment, which is often touted by a book some years ago by Michael Kramer and Rachel Glenister, setting out in their book Good Medicine how to bring innovations into the market. Could you say a little bit about that instrument and how it compares with what you've just described?
Yeah, I mean, I think advanced market commitments have not been used very often in the public health world. I think they could be very effective. I think maybe the reason why they haven't been used so often is they require quite a lot of kind of political will and funding behind them before they can actually go into effect. There's a lot of planning, there's a lot of work needed. So they were used famously for a vaccine market, which I won't talk through in detail, and I think could be quite valuable in other markets in the future. But we just haven't had quite as much experience deploying advanced market commitments, I think, because of just how much effort and funding is needed to kind of set them up. They're also kind of an interesting market shaping tool in that, the market doesn't currently exist for the product in question, right? So you're kind of thinking quite far ahead about what is likely to happen, who the purchasers are likely to be, what the demand is likely to be, and you're sort of providing funding for manufacturers to develop products for a market that hopefully will exist in the future. So you're basically saying the funding will exist to buy products, once you make them available. And that's the incentive for you to actually develop the products and providing some kind of subsidy, so some funding for them to actually go through the R&D process. So in some ways, it's quite a bit riskier than the market shaping interventions that we've used more commonly. So again, that makes it harder to kind of find the right mix of factors to actually implement an advanced market commitment. So I think, it's an interesting tool. It's an important tool. It's one that I'm sure we will use again in the future. But I think in global health markets in particular, there are other tools that are just easier to deploy, that we have more experience deploying, where there are kind of approved pools of funding that we can use to kind of back some of these agreements. And so, yeah, they just haven't been used as frequently, which is why I didn't mention them.
So, may I invite you to reflect back? You've been working on these topics for the last 15 years or so. Reflect back on what's changed in that time. If you had to pick out a handful of changes, what would you think those trends are?
Yeah, I mean, certainly impact has increased massively when it comes to market shaping, right? And that's not necessarily a change in the way that we do business, but a change in terms of the context in which we're operating, right? So I sort of mentioned earlier, I alluded to the fact that after we did the implant deals, there were these kind of, far-ranging consequences. And some of those included donors becoming much more interested in market shaping and in volume guarantees. And so supporting bigger teams, creating new organizations like MedAccess, that could just come in and implement these interventions at greater scale and therefore have more impact. So I think seeing some of the successes of the early market shaping interventions really motivated kind of money to flow into this space, motivated, individuals to come in and want to become market shapers. And we sort of created new institutions, new teams to service that. And I think can now say, we've done, even in the volume guarantee space, we've done dozens of deals. We've reached hundreds of millions of people. I think we've probably saved billions of dollars in public procurement dollars. Um, it's a little bit tough to kind of add up the impact, to be honest, because we're working in different organizations. We don't have, one kind of umbrella organization measuring and adding up the impact and making sure we're not double counting. But I think safe to say we've probably reached millions of people, hundreds of millions of people even, with better health products, and we've probably saved upwards of $1 billion in public sector budgets. So the impact has been massive, and I think that's kind of important to sit with, right? It's been 15 years. In many ways, the field of global health is at a crossroads. So as we sort of think about what have we learned from market shaping and is it worth doing in the future? How do we adapt? Yeah, important to recognize impact has increased massively. I think interestingly for me, the breadth of the impact has also grown. And Michael, you and I have talked about this a lot over the years. I think we've been quite intentional in saying we don't just want to focus on donor priorities. So historically, global health donors really focused on vaccines, infectious diseases, family planning, all of which are kind of really important. We've done a lot of market shaping in those areas, but recognizing that eventually we would see financing in global health shift to domestic governments. And we've already started seeing, the disease burden shift quite considerably to non-communicable diseases. We sort of recognize we need to kind of build experience implementing market shaping interventions in non-communicable diseases. We need to be able to work with purchasers that don't just have donor backing, and we need to be able to operate with a broader set of companies. And I think all of those things have happened. So we've now done kind of market shaping interventions in cancer and nutrition, in primary care. We've gone beyond just vaccines and medicine. So we've done market shaping interventions for diagnostics, for devices, even medical gases. And we started off working with big vaccine manufacturers in the US, Europe, and India, then kind of shifted to big innovator companies making medicines in US and Europe. We've now done these agreements with generic companies. We've done agreements, as I mentioned before, with diagnostic device companies beyond North America, beyond Europe, different countries in Asia, different countries in Africa. So I think that's been a really big shift. It's been very intentional. And I think, again, that sort of is something to reflect on when we think about what the future of market shaping looks like. And then I think, the third kind of big shift I've seen is the sector has become formalized and professionalized in many ways. We had our first market shaping conference focused on global health last year. We talked about some of these publications that describe market shaping tools, these frameworks that have been developed. When I started in this field in 2010, none of those existed. There was maybe one framework I had encountered that tried to sort of describe market shaping tools as part of the UN Commission on Life-Saving Commodities for Women and Children, but it was just one framework as part of one initiative. We didn't have kind of broader publications and kind of theories of change around that. We didn't have kind of working groups that were discussing and debating market shaping tools, learning from past examples. And now we have all of that, right? There are many different market shaping consortia, working groups. We've refined some of our tools and standards. We've published case studies. We've talked about successes and failures. And I think we've just become more inclusive as we've become more professionalized too. So there's definitely kind of a community of practice in market shaping that doesn't just include market shapers. It doesn't just include donors. I think about, for example, in the TB space, we have a meeting that happens every quarter that includes civil society or includes the major purchasers. includes market shapers, includes other NGOs. And that's where the sort of priorities for market shaping are defined. And that's where we're sort of talking about and learning from the successes and failures that we've had in this space. Similar fora exist in the malaria community and the HIV community. And, we can talk about this separately, but I always sort of say, for me, with market shaping, the analysis is quite important, but the people are more important, right? You can run an analysis of any market and sort of say, these are the barriers to access. And for a lot of them, you might conclude market shaping could be valuable, but you're never going to get to the end point of actually implementing an intervention and seeing its success unless you have the sort of right people at the table and you're kind of bringing them together at the right time to intervene in the right market, right? So just figuring out what the right market is one piece of the puzzle. If you don't have the global health community mobilized around a market shaping intervention, and you don't have complementary initiatives that sort of support the implementation of that intervention, it's not going to happen or it's not going to be successful. So I think the fact that we've formalized and professionalized this sector has been instrumental in kind of building those communities of practice and enabling us to increase our impact, in terms of magnitude and also in terms of breadth. So I would maybe stop there and sort of see if you have any reactions to that, Michael.
No, because I think you said there are, with growing impact, really big
Yep.
impact, saving billions of dollars, growing scope beyond
Yeah, exactly.
to non-communicable diseases and so on, and then a maturation of a community, more sophistication and professionalization and collaboration, lesson learning going on. So banking those changes over the last 15 years, can I ask you to look ahead? What do you see as the future of this set of activities, particularly as the world of global health changes in its funding and scope and approach? What do you see as the promises and problems for the future?
Yeah, I mean, I don't think it would be controversial to say that the field of market shaping is certainly at a crossroads. I think the wider kind of global health sector is at a crossroads where we're sort of figuring out how we orient ourselves, how we have impact going forward, whether we should exist going forward, frankly. So I think, yeah, when we reflect, we can say we've developed these tools, we've developed a lot of expertise, we've developed some ways of working. All of those have clearly generated compelling impact over the last 15 years or more, right? There were kind of informal market shaping tools that were implemented even prior to the last 15 years. But those tools have largely been dependent on coordinated or consolidated procurement. So you kind of start with the demand side, and you need to be able to characterize what demand has looked like historically, what demand will look like in the future, and how decisions are made on the demand side. If you don't have those ingredients, none of these tools are really very effective. So they docked quite nicely into these big kind of donor-backed institutional buyers. The purchase volumes covered by those buyers, covered dozens of countries, so they were quite high. Relatively easy to size demand. They sort of had systems whereby they would capture historical orders, they forecast orders, so you could kind of relatively easily build your market sizing analysis. And it was pretty simple to understand how purchasing decisions were made too. Sometimes those decisions were quite complex. When you look at a purchaser like PEPFAR, they were beholden to congressional approval of their budgets every year. So sometimes you wouldn't have perfect visibility into how decisions were made. But, I think by and large, relatively easy to sort of characterize what was happening on the demand side. And therefore to devise market shaping solutions that you could be somewhat confident would generate impact. That said, it was always inevitable that these donor-backed procurement programs would go away. I think what's changed in the last several months is we've sort of accelerated the timeline of that inevitability. And so I think we have options, right? We could let the field of global market shaping contract as these big procurement programs go away. We could be somewhat passive and say, we're going to kind of wait and see what happens, if they come back, if they grow, if they shrink, and we're going to sort of adapt our plans, our pipelines accordingly. Or I think if we really believe we can continue to have massive impact, that we can adapt to a world in which procurement decisions are happening at the regional level, manufacturing is maybe happening at the local or regional level, then we can maybe envision bold new, regional centers of excellence for market shaping. It's going to require some change, some adaptation, but it's possible, right? So I guess in my view, of course, you can tell by the way I'm sort of telling the story, I think we as market shapers should mobilize quite actively and try to support the creation first of these regional demand side platforms where we're able to coordinate or pool procurement, because without that, we're not going to be able to implement market shaping. But more importantly, I think, we've seen successes in other regions of the world and other sectors of the world when you pool procurement. Certainly, that's been, I think, one of the big lessons learned from the global health architecture that we've built. We can save a lot of money, we can reduce lead times, we can make sure more people have access to critical health products when we pool procurement. So I think it's in everyone's best interest as we sort of see procurement becoming decentralized to find platforms where we can at least coordinate purchases. And I think as market shapers, we should be supporting that. And then, in parallel, I think we have a real opportunity to use artificial intelligence to kind of democratize market shaping. So I mentioned before, we develop these tools, we develop these ways of working. I think it would be pretty easy with existing kind of AI software to translate that into algorithms that help a broader set of market shapers to make decisions. So you don't need to hire, 20, 30 analysts, build up new organizations to figure out where, market shaping priorities exist within your kind of budgets, within the kind of orders that you're placing every day. We should be able to generate tools that can take your logistics management information system outputs, take your order book, take, what different countries are buying and say, here are the opportunities for you guys to pool demand, to actually reduce prices, to structure budgets so that, in a world where it's tough. You saw the news from Botswana a couple of days ago. We're seeing governments say we just don't have enough money to support our health systems. In that environment, we can kind of bring our data together, figure out where opportunities exist to really reduce prices, to improve lead times, to improve access. We can figure out what tools might be best suited to solve those problems. And we can kind of simulate the way different market actors might behave in response to changes in the market to say, well, what's the right negotiation strategy? So I think there's a real potential to sort of build regional market shaping with what we've learned, but also leveraging new tools that can just make it easier, faster for us to deploy market shaping in a much bigger way. So I think the future is bright. I think we can sort of empower regional decision makers to take on the helm of market shaping and really kind of expand impact going forward. But yeah, it's not certain. It's going to require all of us to kind of come together and support this bold vision. It's going to require, a certain level of platform building at the regional level, but I think it can get there.
Can I? So there's a very compelling vision you set up. I find it attractive. Can I just test? I mean, is there a world in which all of those functions, that kind of aggregation of demand, the use of artificial intelligence to read future demand and stitch together better deals, is there a world in which that's just done by commercial organizations? We no longer need philanthropies and charities and so on to do that work?
I think it could be done by, I would sort of suggest that governments own it first and foremost. Just sort of thinking through the vision of universal health coverage. I think it sits best with demand side actors or their allies, right? Even the way we develop market shaping interventions today is working very closely with purchasers, with NGOs, with civil society. And of course, at some point, you're negotiating with pharmaceutical companies. So I suppose that's where I would sort of sit this kind of effort first and foremost. I think commercial entities could do it. There would be kind of fees charged, right? So you would maybe sort of temper the impact you could have, but I think it's definitely possible, right? The technologies are out there, the know-how is out there. I think, people who've done market shaping for many years would probably need to be involved in the design. But yeah, I mean, I think this could sit within commercial entities that are interfacing with governments and with private sector purchasers interfacing with suppliers. It could sit within governments, could sit within kind of parastatal organizations or regional economic cooperation fora. So I think there are a lot of places where, market shaping expertise could be developed and market shaping tools could be deployed. I'm sort of agnostic to who owns it, but I just think it would be such a shame to sort of lose everything that we've built and achieved. Or for people to think, God, it's just too cumbersome, costs too much money, it has no place in a world where donor funding doesn't exist. I think that would be sort of an overly simplified view of the world.
Okay, thank you. I mean, I think that there's the counterfactual, isn't there? That if nobody does this kind of work, you could be in a place where a number of very fragmented purchasers are unable to negotiate better prices, or unable to negotiate better supply deals. And we find that supply chains can become quite fragile, products expensive and unavailable if it's not tackled, especially at a time when we see the proliferation of demand across products. Uh,
Yeah, exactly. So I think the the healthcare market, I think, is quite vulnerable at this stage. It always is. I think any place you go in the world, access to medicines are is a hot button issue, right? And there are certain populations that can't afford the medicines that they need. So there's no country in the world, no community in the world where we've kind of solved the issue of access to healthcare, of universal health coverage, of access to medicines. So in that environment, any kind of shock to the system, any sort of change in financing will sort of mean that fewer people get access to healthcare. And so, yeah, I think now is not the time for us to forego any of the tools that we have. I think it's sort of all hands on deck. Anything that we have that has the prospect of stretching the dollar or the naira or the rupee to meet the needs of more people, we should tap into, right? And so I think in that context, market shaping tools are important. They're not the only thing that matters, but we absolutely have to use them, right? And we're talking about life or death. So I think for me, there's such urgency around doing this work because I've sort of seen what happens when medicines aren't available to people, and it can mean people just don't survive and their lineage doesn't survive. And yeah, the effects are quite drastic. I've seen that in my family personally. So for me, we can't let go of the gains that we've made. We can't let go of these tools. Anything we can do to improve access to healthcare, you must do.
Hema, that's a perfect coda for the discussion. I think encapsulating what it means for people, and we can't let go is a great call for the future. Thank you so much for talking to us today and explaining these various tools and your experience in market shaping.
Thanks, Michael.